Hi there, welcome back to Invodent Mosby'S series. This part we are going to learn about external carotid artery. In the part 1 we have learned about the blood supply to the head and neck region and the subclavian artery, branches of subclavian artery. Now in this part 2 session we are going to read about external carotid artery, which is one of the major branches of common carotid artery. Without any delay, let us go into the details of the branches of external carotid artery. So as you can see in this picture, there are 8 major branches of external carotid artery which are supplying the major regions of head and neck region and including the oral cavity. So the first and foremost branch is superior thyroid artery. So superior thyroid artery, let us learn in respect to the region which they are supplying. So this is the thyroid region. So it makes sense, superior thyroid artery in the region of thyroid. So the first branch of external carotid artery will be superior thyroid artery. Leave it there, come forward. They are lingual artery, facial artery and maxillary artery. So see the lingual artery here. It is in the region of the mandible, facial artery, and this is the maxillary region, maxillary artery. So in the mandibular region we can see lingual artery, and in the maxillary region we can see maxillary artery. In between maxillary artery and the lingual artery we have the facial artery. So superior thyroid, lingual, facial and maxillary artery. In the temporal region we find superficial temporal artery. Then after that, again going posterior region, we have posterior auricular artery. Alright, so this is the posterior auricular artery behind the auricle, and in the occipital region we have occipital artery. We are left with ascending pharyngeal artery. So these are the 8 major branches of external carotid artery. Let us revise once all the names of 8 branches. Superior thyroid artery, lingual, facial, maxillary, superficial temporal, posterior auricular, occipital, ascending pharyngeal. Now coming to the details of the first branch, that is superior thyroid artery. This superior thyroid artery originates from the anterior aspect of external carotid artery. As you can see, it is coming from the anterior aspect of external carotid artery, just above the carotid bifurcation and below the hyoid bone. We can see the superior thyroid artery branching out from the anterior aspect of external carotid artery. Further to that, the superior thyroid artery is divided into infrahyoid artery. So this is hyoid bone and we are having it below to that, it is infrahyoid artery. This infrahyoid artery is going to supply the infrahyoid muscles. Then the next sub-branch of superior thyroid artery would be superior laryngeal artery. So this superior laryngeal artery will combine with internal laryngeal nerve, and this is going to supply the muscles of larynx. This is the laryngeal region. So this artery is superior laryngeal artery, which is supplying the muscles of larynx. Then sternocleidomastoid artery is also one of the branches of superior thyroid artery. This superior thyroid artery will supply some portion of the sternocleidomastoid muscle through this sternocleidomastoid artery. And we also have cricothyroid artery, which is supplying the thyroid gland. So the superior thyroid artery is further divided into infrahyoid, superior laryngeal, sternocleidomastoid artery and cricothyroid artery. Further to superior thyroid artery we have lingual artery. Lingual artery is again coming from the anterior aspect of the external carotid artery, but it is very near to the hyoid bone, and according to few textbooks they even say that it is arising at the tip of the greater corner of hyoid bone. So the lingual artery is also further divided into suprahyoid artery, dorsal lingual, deep lingual, sublingual. Alright, suprahyoid artery is supplying the suprahyoid muscles. Dorsal lingual artery will be supplying the tongue, tonsils and the soft palate. Tongue, tonsils and soft palate are supplied by the dorsal lingual artery. Deep lingual artery will be supplying the tongue, and the sublingual artery will be supplying the sublingual, means floor of the mouth, mylohyoid muscle and the sublingual gland. So we have learned about superior thyroid artery and its branches, lingual artery and its branches. Next is the facial artery. Facial artery is further divided into many other branches. As we can see here, it gives off ascending palatine artery. Okay, ascending palatine, tonsillar, glandular. Remember these three at once: ascending palatine, tonsillar and glandular. Then goes submental, inferior labial, superior labial, lateral nasal and then angular artery. Alright, so remember these three at a stretch and on the profile these three arteries at once. Then it will be easy. So the facial artery is further dividing into ascending palatine, tonsillar, glandular, submental, inferior labial, superior labial, lateral nasal and angular arteries. So ascending palatine artery is supplying soft palate, tonsils and pharynx. Okay, ascending palatine artery is supplying palatine, right, soft palate, and adjacent to that will be your tonsils and pharynx. So that regions of soft palate, tonsils and pharynx is supplied by ascending palatine artery. Coming to the tonsillar artery. See, tonsillar artery is T. It also supplies two T's, tonsils, tongue. Tonsillar artery supplies tonsils, tongue. Then comes glandular artery, gland. Which gland? In the before slide we have seen sublingual gland is supplied by the sublingual sublingual artery. So now what is the remaining gland? That is submandibular gland. So submandibular gland is supplied by the glandular artery. Then comes our submental. Even submental artery is going to supply the submandibular gland. Okay, so even a submental artery is going to supply our submandibular gland. Along with it, mylohyoid and anterior digastric muscles also. Okay, in this region we have mylohyoid, right, and an anterior digastric muscle. So that's why this submental artery is supplying three major areas: submandibular gland, mylohyoid and anterior digastric muscle. Next is inferior labial. As the word says, inferior labial, it supplies the lower lip. Superior labial artery is supplying the upper lip. Superior labial, upper lip. Lateral nasal is supplying the nose. Angular artery will supply to the nose as well as the eyelids. So these are the major branches of the facial artery. Now, so that we have learned about the three major branches like superior thyroid, lingual and facial artery. Moving ahead, we have something known as maxillary artery, which we will be learning at the last. Then now we will learn about ascending pharyngeal artery. So as we can see here, ascending pharyngeal artery, which is the branch of external carotid artery just above the level of superior thyroid artery. So superior thyroid artery is coming from this region. Just above the level of superior thyroid artery, we can see the emergence of ascending pharyngeal artery, which is branching out from the external carotid artery. This ascending pharyngeal artery will supply the pharynx, soft palate and even meninges. Moving on ahead, occipital artery, which is branching out from the posterior aspect of external carotid artery and which is very close to the hypoglossal nerve. It is very close to the hypoglossal nerve. This occipital artery will supply to the dura mater, meninges, posterior aspects of the occipital portion of scalp, sternocleidomastoid, suprahyoid muscles. So all the tissues or the organelles which are present in that region is supplied by the occipital artery. Let us revise once again: dura mater and meninges, sternocleidomastoid muscle and suprahyoid muscle, and the occipital portion of the scalp. So these are the areas which are supplied by the occipital artery. Coming to the posterior auricular artery, it is also a branch which is coming from the posterior aspect of the external carotid artery. Okay, and very important to remember that it is emerging near to the level of styloid process. Okay, it will emerge near to the styloid process, superior to the stylohyoid muscle. These are the two important points that we have to remember. It emerges at the level of styloid process and superior to the stylohyoid muscle. Now this posterior auricular artery will supply mastoid air sinuses, stapedius muscles and internal ear. Mastoid bone will be there here, mastoid air sinus, air cells, okay, mastoid air cells, stapedius muscles and internal ear is supplied by posterior auricular artery. So, and superficial temporal artery will supply to that particular region of temporal region, and this is the terminal branch of external carotid artery. Now we are left with maxillary artery. We will see it now. So now let us look into maxillary artery. So maxillary artery is having three major parts of it. A first part or mandibular part, pterygoid part and pterygopalatine part. So each of this region of the maxillary artery is having further sub-branches. When it comes to the mandibular part, it is having deep auricular artery, anterior tympanic artery, inferior alveolar artery, middle meningeal artery and accessory meningeal artery, of which deep auricular artery and anterior tympanic artery are going to supply the tympanic membrane, whereas inferior alveolar artery is going to terminate as mental artery and going to supply the mandibular region. Middle meningeal artery is very important. It is traveling through the foramen spinosum and it will be supplying to the meninges of the brain. So these are the branches of the first part of the maxillary artery. When we come to the second part of the maxillary artery, the pterygoid part, it is further divided into deep temporal arteries which are supplying the temporalis muscle. Deep temporal supplying to the temporalis muscle. And there are something known as pterygoid arteries. This pterygoid artery is going to supply medial pterygoid and lateral pterygoid. Mesenteric artery is going to supply the masseter muscle. Then it is buccal artery or buccinator artery which is going to supply the buccinator muscle and buccal mucosa. And the last part of the maxillary artery is pterygopalatine part, or the third part of the maxillary artery is further divided into posterior superior alveolar artery which is going to supply the maxillary sinus, molars, premolars, all the posterior teeth and along with gingiva. The blood supply is because of posterior superior alveolar artery. The descending palatine artery is further dividing into greater palatine and lesser palatine arteries. And then infraorbital artery. They terminate as nasal and palpebral branches of maxillary artery. And this infraorbital artery is going to supply the orbital region, facial tissues and the maxillary sinus and also the maxillary anterior teeth. So these are the major branches of maxillary artery. So we have learned about the 8 major branches of the external carotid artery. So this is a flowchart that I have written for you all for a quick revision. So external carotid artery is divided into superior thyroid, lingual, facial, ascending pharyngeal, occipital, posterior auricular and maxillary. So superior thyroid artery is further divided into infrahyoid, superior laryngeal, cricothyroid and sternocleidomastoid muscle artery. Lingual artery is further divided into suprahyoid, dorsal lingual, sublingual, deep lingual. Facial is further divided into ascending palatine, tonsillar, glandular. These three at a time: ascending palatine, tonsillar and glandular, submental, inferior labial, superior labial, lateral nasal and angular. Occipital, posterior auricular and maxillary. Maxillary is further divided into mandibular, pterygoid and pterygopalatine. Mandibular is deep auricular, anterior tympanic, inferior alveolar, middle meningeal, accessory meningeal. Second part, deep temporal, pterygoid, mesenteric, buccal. Pterygopalatine, artery to pterygoid canal, posterior superior, descending palatine, spinopalatine and infraorbital. So these are the major branches which are given off by the external carotid artery. See you all in the next session for internal carotid artery. Thank you for watching Invodent Mosby'S series.